Like it or not, the CDC is recommending everyone wear a mask while indoors in certain parts of the country. The health agency announced a change in its recommendations on Tuesday after seeing a rise in breakthrough cases in certain regions. The CDC says new data shows even vaccinated people who contract COVID-19 can spread it. Vaccine maker Pfizer is now encouraging people to get a third booster shot. The company says it will increase a person's resistance to the Delta variant. Pfizer says protection against the virus increased 5-fold when given to people between 18 and 55. The level of protection increased 11 times for those 65 to 85. CBS News' Skylar Henry has more on the updated recommendations.
CDC Director Dr. Rochelle Walensky says new data shows even vaccinated people could end up being a threat to others.
If you are vaccinated and you are one of those rare breakthrough infections, you actually have the capacity to pass it to somebody else.
Dr. Walensky said that's one of the reasons the CDC has changed its mask-wearing guidance. The agency now says even people who are vaccinated should wear masks indoors in areas of high COVID transmission. That applies to more than 63% of all counties in America. Dr. Walensky says because the majority of school kids aren't yet vaccinated, the CDC is also recommending all students, teachers, and staff in grades K through 12 wear masks.
We don't have vaccines available yet for children on 11 and younger. And our children who are 12 to 17, only about 30% of them so far going into the school year have been vaccinated.
The House of Representatives is following the new guidance requiring masks indoors. And vaccine mandates could be on the way for more than 2 million federal workers. The White House is finalizing an order that federal workers and contractors will soon be required to confirm they are either vaccinated or get tested regularly.
That's under consideration right now, but if you're not vaccinated, you're not nearly as smart as I thought you were.
The Department of Veteran Affairs announced Monday that it is giving its frontline healthcare workers 2 months to be fully vaccinated. Skylar Henry, CBS News, Capitol Hill.
Joining me now is Dr. Eric Cioe-Pena. He is the Director of Global Health and an emergency room physician at Northwell Health. Dr. Cioe-Pena, thank you so much for joining us. So as a doctor who clearly encourages people to get vaccinated, are you worried that this new mask mandate or recommendation by the CDC will take away some of the incentive for those who are still not vaccinated because they make the mental calculation, well, I'm going to have to wear a mask anyway? Or do you think that that is not a necessary consideration?
Well, I think it's definitely a consideration. And, thank you for having me, by the way. I think that more importantly, though, this is a reflection on the vast number of Americans that are not vaccinated yet. My hope actually is that it'll serve as a pressure point where people who are vaccinated in society will turn to their friends who aren't vaccinated or on the fence and say, look, man, I think we got to end this, right? Like, this is something that, we have the power to end in this year. And we're choosing not to with the level of vaccination that we have. So, the mask mandate does majoritively protect the unvaccinated. These vaccines are still very, very good at preventing hospitalization and death. But until we get more people vaccinated, this is the reality.
So I just want to follow up on something you said. You said wearing masks largely is protection for the unvaccinated. Is that correct? Correct.
Yeah. The virus itself is not really a huge threat to people that are vaccinated. If you're vaccinated, sure, you can get a breakthrough infection. Even that's rare. But the chances of you getting hospitalized or dying from COVID after receiving one of the COVID vaccines is as close to zero as you can get in public health.
But see, that is what's, I think, causing mounting frustration at people who are still not vaccinated among the vaccinated, because there's this sense, we did our part. We all got vaccinated. It seemed to be under control. We were able to take masks off indoors if we were vaccinated. Everything seemed to be going in the right direction. Now, with this Delta variant, we seem to be losing ground. And it seems that those who are vaccinated are getting quite frustrated with those who are still not vaccinated. Is that what you're experiencing as well?
Certainly, yeah, I've seen that a lot, and I've personally felt some frustration. I think we all need to just take a deep breath. There are people that have legitimate concerns that we need to address. All of the concerns that they have are answerable at this point. You know, there really is no major safety risk with any of the vaccines. We just need to have conversations. We need people to go see their doctors and have conversations with their doctors. And you know, if you're on the fence, I think the message is this is the week to go get vaccinated. Delta is much more contagious, and the vaccination rates need to be much higher than they currently are in order to prevent another surge.
I saw a doctor post somewhere, and I'm not going to remember the doctor's name and ask you if this is correct, but he posted somewhere on Facebook saying, if you are still unvaccinated, you have about an 80 to 90% chance of getting this Delta variant. Does that sound about right to you?
I mean, I think it's very relative to where the doctor's practicing and what the baseline prevalence is, but certainly in a place where COVID is surging, I think that's a relatively good statistic. If you come into contact with someone that has an active infection with Delta and you are unvaccinated, you have a great 80 or 90% chance of getting that infection. It is a highly contagious respiratory pathogen that we need to respect. So 100%, I agree with that sentiment in terms of your exposure versus getting infected rate.
And Dr. Cioe-Pena, as you know, school is starting soon, and now we have these new CDC recommendations for students in schools, students, teachers, administrators, whether vaccinated or not. The CDC is recommending they wear masks. Would you suggest that it would be a good idea for schools, especially public schools, to provide masks sort of at the door, at entry, for everyone who needs to enter that school?
Yeah, I think so. I think that's a great way to remove equity and access issues to masks, is just, have a mask at the door. And if you don't have one, just put one on. I do think that this, this guideline is, again, it's a very difficult guideline to enforce, that the kind of the division between 12 and under 12 and over 12. So I think just requiring everyone to wear masks is safer, especially with the prevalence this year. And until we can get the vaccine more available to younger populations, that's probably going to be the reality in schools, and until something changes again with the eligibility for vaccine.
And are you also seeing the rate of infection go up in younger Americans? And is that due to the fact that they are sort of more the unvaccinated population, simply because 12 and under can't yet get one? Or is that because the Delta variant seems to be more contagious among younger people?
So the Delta variant is more contagious among all people, but certainly the people that are unvaccinated, of which under 12 is a big population. But even the younger people that are unvaccinated, we're seeing a skew towards people being younger. So if you're under 40, your chances of being unvaccinated or having decided not to get the vaccine are much higher than people over 40. Really young kids, the kids under 9, we're still seeing that they are not getting as bad a disease or not as contagious as kids above 9, but it is much less of a difference with Delta than as compared to Alpha.
All right. Well, Dr. Eric Cioe-Pena, thank you so much for joining us. We appreciate your insight.
Thanks for having me.